Question 1. The exchange of gases between the blood and the tissue fluid occur across the wall of the. The right answer is option C, capillaries. Question 2. The type of cartilage that make up the ring of the trachea is. The right answer is option C, hyaline cartilage. Question 3. Which of the following is not a part of the lower respiratory tract? The right answer is option D, nasal cavity. Question 4. The root of the lung is where the primary bronchus, pulmonary artery, and pulmonary vein enter and exit the lung. This region is called the. Right answer is option C, helium. Question 5. The smallest structural and functional unit of the lung is the. The right answer is option B, alveolus. Question 6. The respiratory zone begins with the. The right answer is option B, respiratory bronchioles. Question 7. The two primary bronchi are formed from the division of the. The right answer is option C, trachea. Question 8. Which cartilage is sponge shaped and form the superior part of the larynx? The right answer is option C, epiglottis. Question 9. The main function of the concha in the nasal cavity is. 2. The right answer is option B, increase the surface area for warming and humidifying air. Question 10. Quiet expiration is primarily of process. The right answer is option B, fascia. Question 11. The pressure in the alveoli is called. The right answer is option B, intrapulmonary pressure. Question 12. The difference between intrapulmonary and intrapleural pressure is known as. The right answer is option A, transpulmonary pressure. Question 13. The inability of the lung to adequately ventilate leading to retention of CO2 is called. The right answer is option B, hypoventilation. Question 14. What is the approximate average respiratory rate for a healthy adult at rest? The right answer is option B, 12 to 20 breaths per minute. Question 15. The volume of the air breathed in and out per minute is called. The right answer is option C, minute ventilation. Question 16. If a patient intrapleural pressure become equal to atmospheric pressure, what condition might occur? The right answer is option B, pneumothorax, mean lung collapse. Question 17. The force that tend to collapse the alveoli is. The right answer is option C, both A and B. Question 18. The inspiration reserve volume IRV is. The right answer is option B, the maximum amount of air that can be inspired after a normal tidal inspiration. Question 19. Which of the following factors would decrease airway resistance? The right answer is option C, release of epinephrine. Question 20. In the process of external respiration, oxygen moves from the. The right answer is option A. Alveoli to the blood. Question 21. Carbon dioxide is about 20 times more soluble in plasma than oxygen. This is important for. Right answer is option B. The age of CO2 diffusion across the respiratory membrane. Question 22. Which of the following condition would increase oxygen loading onto hemoglobin in the lungs? The right answer is option C. Increased pH. Question 23. The term ventilation for fusion coupling refer to the matching of. Right answer is option A. Airflow to blood flow in the lungs. Question 24. The Helden effect described. The right answer is option C. The increased binding of CO2 to hemoglobin when Q2 is low. Question 25. Why do fetal hemoglobin have a higher affinity for oxygen than adult hemoglobin? The right answer is option A. To maximize oxygen uptake from the mother blood. Question 26. At higher altitude, the partial pressure of oxygen in the atmosphere decreases. How does the blood adapt to this initially? The right answer is option B. Increased production of 2,3 BGF. Question 27. The Fontaine Respiratory Center play a role in. The right answer is option B. Modifying the basic rhythm of breathing set by the medulla. Question 28. If the vagus nerve were served, what would be the effect on the horning brave reflex? The right answer is option B. The reflex would be abolished. Question 29. Which of the following would not stimulate an increase in respiration rate? The right answer is option D. Increase in arterial fluid. Question 30. Strong emotion and pain can alter breathing pattern through the influences of the. The right answer is option B. Limbic system and hypothalamus. Question 31. What is the effect of severe blood loss on respiration? The right answer is option B. Increase respiratory rate to compensate for reduced oxygen carrying capacity. Question 32. Chronic bronchitis is characterized by. The right answer is option B. Inflammation of the bronchial tube, increased mucus, and persistent cough. Question 33. Acute respiratory distress syndrome ARD is often involved. The right answer is option B. Widespread inflammation and fluid accumulation in the alveoli. Question 34. The collapse of an entire lung or a portion of the lung due to airway obstruction or pressure change is called. The right answer is option C. Atelectasis. Question 35. Which condition is most commonly associated with exposure to asbestos? The right answer is option C. Mesothelioma. Question 36. A blue blotter is a term sometimes used to describe a patient with. The right answer is option C. Chronic bronchitis. Question 37. A pink puffer is a term sometimes used to describe a patient with. The right answer is option B. Emphysema. Question 38. The partial pressure of water vapor in the inspired air. The right answer is option A. Decrease the partial pressure of oxygen in the inspired air. Question 39. What is the role of angiotensin converting enzyme ACE found in the lung? Right answer is option B. Convert. Angiotensin 1. Question 40. The condition of insufficient oxygen being delivered to the tissue despite adequate blood flow is termed. The right answer is option B. Anemic hypophysia. Question 41. The process of quiet inspiration. The right answer is option B. Involve contraction of the diaphragm and external intercostal muscle. Question 42. Which of the following would tend to increase the total surface area available for gas exchange in the lung? The right answer is option C. Increased number of healthy alveoli. Question 43. The main effect of carbon monoxide poisoning is. The right answer is option C. Binding to hemoglobin with much higher affinity than oxygen. Question 44. The physiological dead space is. The right answer is option B. The sum of anatomical dead space and alveolar dead space. Question 45. What happened to the bronchiole during an asthma attack? The right answer is option B. They constrict. Question 46. The volume of air that remain in the lung even after a maximal exhalation in the right answer is option C. Residual volume. Question 47. The most crucial factor in determining the direction of gas movement across the respiratory membrane is. The right answer is option C. Partial pressure gradient. Question 48. What is the function of type 1 alveolar cell? The right answer is option C. Formation of the respiratory membrane. Question 49. The rhythm of breathing is primarily set by neuron in the right answer is option B. Medulla oblongata. Question 50. Which condition is contraindicated for beta blocker? Right answer is option C. Asthma.